what does exercise mean to us? What is appropriate exercise? Well, our biggest recommendation is 150 minutes of moderate intense activity. So, what do I care more about? I care about consistency. So if you can't allocate, which equates to 30 minutes 5 days a week or 50 minutes 3 days a week, if you can't allocate that, the more important thing is consistency. So if you can only do 15 minutes a day, do 15 minutes. I've seen a lot of people who do that consistently, even 10 minutes, and have amazing results. So if you can't allocate that 150 minutes, if you can be consistent and if you can watch what you're eating, you don't have to be perfect, but you do have to be consistent. You do have to realize that you're going to have days where things may not go the way you want it to. I've had days, sometimes I've had weeks, sometimes I've had months. Mental health is a huge component of it too. So if you're dealing with stresses of the world, it is going to impact your health, and sometimes it can impact the way that you eat. Which brings to the second topic of understanding what you do during stress. For me, when I am stressed, unfortunately, I look for the easy foods, the cheap foods, and unfortunately the unhealthy foods. So starting to recognize that more, to understand what I do during stress and kind of journal that down, but also work on daily tasks as to telling myself or writing down that no matter how stressful the day is, I will not utilize junk food as the way of me releasing, sometimes communicating with individuals, for me, my spouse or close friends, as to what's going on and how I'm feeling. Sometimes even my office mates, we just have sessions where we talk about what's going on in our lives, and I find that to be helpful in also releasing the stress, but also not reaching for inappropriate ways of handling your stress, such as junk eating. So why is this important? Why is it important for us to exercise? Number one, as we get older, especially for women, our bones get weaker. So strength-based exercising is going to be very beneficial for all of us, but especially for older women. There's some studies showing whether it's due to menopause and the decreased amounts of estrogen that can be playing a key factor, but nevertheless, strength-based exercises helps in strengthening our bones and making us, not just live longer, but live a good and quality of life. So get your exercise in and make sure you incorporate using weights, using resistance when you are exercising. Second one, or third one, I don't know where I'm at in my numbering, but exercising decreases the risk of heart disease. Exercise decreases the risk of heart disease. So getting that exercise in is going to mold your heart to perform physically at its best. And by doing this, is also going to help to control the blood pressure. Controlling the blood pressure decreases the risk of a lot of cardiac diseases, such as cardiomyopathy, enlargement of the heart failure, heart attacks, strokes themselves, which can lead to dementia. But also understand that high blood pressure, and especially high blood pressure in individuals who are diabetic, are two of the biggest risk factors that leads to end-stage renal disease, kidney disease, needing dialysis. So exercising is a way that you can fight against this. You can fight against high blood pressure. You can fight against type 2 diabetes and decrease the risk of the previously mentioned things. So mentally, what does exercise do? For me, this is me personally, I find that I'm less depressed when I'm exercising consistently. So there is benefits in exercising and decreasing the risk of anxiety, depression, and mental health overall. So making sure that you get that exercise and understand that it helps you more than just being tired. It helps your heart to perform at its physical best. It decreases the risk of high blood pressure, which can lead to significant cardiac dysfunctions. It decreases the risk of osteopenia, osteoporosis, strengthens the bones, decreases the risk of certain cancers, decreases the risk of or helps to treat your anxiety, depression. So there's a host of a lot of different things that exercise can do for certain individuals. I do understand that there are individuals who are not able to do certain exercises or exercise at all, secondary to comorbidities, but anything that you can do to put your body at a test and increase the heart rate, putting yourself in physical challenge to decrease all of these things I previously mentioned would only help to just, once again, lengthen your life, but also lengthen the quality of your life. I would like to know, what type of exercises do you guys do that you find benefit in? I'm still trying to figure out what works best for me. I find that I like to do a little bit of everything. Yesterday I had pretty much 50 minutes of cardio, and then I had a little bit of a little bit of everything. High intensity exercises, what I did using dumbbells and body weight. So certain days I'll go straight gym bro mode where I'm doing bench, squat, but find myself that when I'm doing body weight exercises, and especially using dumbbells, I'm able to incorporate different exercises at once. I did like a curl squat, shoulder press as one move, and it's pretty amazing that you can get a complete body workout with not using extremely high weights, but doing multiple repetitions and feeling your best. I feel amazing today. Of course, a little bit of back pain because I slept in my son's room with him, and it's not the best bed for my lumbar support, but nevertheless, like to know what you guys do for exercise, and let me know in the comments. This is Dr. Isang, just stressing the importance of heart, health, and prevention.